Welcome to Invisible Me, a podcast centred around invisible health issues and the feeling of not being seen and heard. Yet here I am, standing right in front of you. Does this sound familiar? Well, come join the conversation. Share your experiences. Let's break down those norms and attitudes for the better. This is a safe space to chat with me, Pat. Good evening. Welcome, Mathilde.
Hello, thank you so much for having me on.
You're talking about a subject that's not that well discussed or spoken about. Could you tell us what you're going to share and educate us a little bit about today? And how long ago did it all start for you?
Of course. So, I have been diagnosed with endometriosis. It's a condition which is actually lifelong, and I think it's 1 in 10 women. Last time I saw the statistics, it's 1 in 10 women actually have endometriosis.
Sure.
Some suffer with it more than others, some get pain, some don't. But it's where the lining of your uterus grows outside of your womb. So, for example, that could be the fallopian tubes, that could be the ovaries, around the pelvis and around your bowels. And I've even heard of some cases where a woman had a sore shoulder, and it's because she had endometriosis particles and fibres in her shoulder.
Mind blowing.
Can you believe it?
That's something. I was going to say it travels, but my goodness, that has travelled.
I know. And like in the eye, I've heard some cases of endometriosis in the eyes,
Wow.
which is just absolutely crazy. And you just wouldn't even think.
A bit scary, really.
Very scary. So I was diagnosed with endometriosis in April last year. So it's been just about 1.5 years that I've actually had my diagnosis.
Yes.
I'm now 21. And I was battling the symptoms and going to and from the hospital doctors with these symptoms since the age of about 12, 13 when I started.
Oh, that's a long journey to diagnosis.
Very, very long. So I waited about 5.5 years, I think it was by the end of it, nearly 6. And
right.
I had no clue what endometriosis was up until about 1 year before my diagnosis, which actually knowing about the condition led me to push in the right direction to actually find, ask the right questions and got the right answers. But if I hadn't known what endometriosis was, I just would have been so lost in that feeling of being in so much pain and no medical professional actually understanding your symptoms.
Now, that's key, just what you said there, just to stop you for a second.
Yeah.
Not being understood. I feel this happens a lot, talking to many folk about invisible illnesses and health conditions. Not everybody's an expert in that field of your condition.
Yeah.
Which is a bit sad. So then you have to fight for yourself, and not everybody has that courage to do that, or that support network like family and friends.
No.
Can I ask, were you heard? Were you believed when you kept saying, I have so much pain? They're going, it's just painful periods. It's normal. You're just 12. Now you're 13. Now you're 14. It's just your hormones, your life changing, your body's changing. Were you believed that was more than that, or were they excuses or reasons found for you to have so much pain?
Yes.
How was the behaviour towards you as a teenager growing up, talking about this and trying to say, hello, something's wrong?
Yeah. So first of all, I was kind of in denial within myself. I had just had my period, so I was probably about 12 when I came on.
Yeah.
And I started experiencing, cyclical pain, the cramping.
Yep.
And for me, I was just like, oh, like, this is periods. I was told.
This is it?
Yeah, I was, I was told that it was going to be painful. It is.
Mm-hmm.
I think it got worse. And then I do a lot of dance.
Yes.
Just graduated from a dance college. I did dance when I was younger. So it's been a massive part of my life, and doing a lot of exercise has always been part of my daily routine.
Sure.
So at this point, I was in so much pain that I actually couldn't do my dance classes. So for me, it was just no question. It was the dance that I was actually overusing my back, and my pain started in my lower back,
right,
which is the pelvic area.
But as a normal person, we rationalise and we try to find the reasons why. Oh, this is why my back hurts. I'm really dancing hard. I'm working hard. I'm overdoing it.
Yeah.
So we do justify it. But
exactly. And of course, a young 12, 13-year-old going to the doctors with back pain, doing extensive hours of dance a week, they're just going to think, yeah, you're just overusing your back. You need to give yourself a rest.
Yeah.
You've just pulled a few muscles and they'll be fine in 4 to 6 weeks. So I just thought, okay. But what was weird to me is that I couldn't pinpoint that pain. I couldn't recreate the pain. And usually when you have an injury, when you've pulled a muscle, you can stretch it. You can move the joints around to feel where that part of your body is sticky or where you've had an actual physical injury. And I couldn't recreate that pain. And that's why in my head, like, I didn't actually tell anyone this. Just in my head, I was just like, it's so weird. Like, I just don't know what I've done, because the doctors were asking me, is it like a jump, landing a jump? Is it like a certain position that you've had your leg in that's caused, like, something in your pelvis to be painful? And I was thinking, like, no, I can't think. There's no specific point in my lessons that I just thought, ow, that caused the pain, which should have rang alarm bells for me, really, but not knowing about the condition.
But you were young.
Exactly.
You know, how were you supposed to? You were accepting what the adults in the professions were saying.
Exactly.
They were trying to process of elimination, trying to work out, you know, almost like a physiotherapist would.
Yes.
Oh, when you put your leg this way, is that why you've got pain?
Exactly that.
Because you couldn't tell them where it's localized. You couldn't actually say it.
It was just
really
my
hurt.
Low back. Yeah, low back pelvis. It was so. Ugh.
So, what treatment? Any treatments? Were you on painkillers or gels or heat and cold? What did they suggest at that point?
So at that point, it was quite early on. Medication such as just your over-the-counter painkillers, which my body is genuinely immune to now because I've taken so many of them, which is so bad.
I hear you.
so bad. But when I'm in pain now, I don't even look at paracetamol, ibuprofen. It just does not fix it. So yeah, that was the initial. And then it was, have you had a hot bath? Have you tried bath salts?
Yeah.
Have you tried a hot water bottle? Yes.
Hello,
and yes.
Yes. Can I ask, out of my ignorance, when you were going through the menstrual cycle and having a normal bleed, was that process just a normal bleed?
Yeah.
And then it would go, and then you were pretty much monthly, you know, and all of that. So that process itself was just normal.
Yeah.
It's this exceptional pain. Was the pain around all the time, or was it just on the monthly cycle, the pain?
At the beginning it differed. So my periods have always been very regular. No issues that would stick out like a sore thumb that you would think, oh, it's something to do with my menstrual cycle. So no excessive bleeding, no irregularities in there. So I never saw them as like a red flag.
Sure.
So I never did any research into that area, if that makes sense.
Mm-hmm.
Because one of the main symptoms of endometriosis is that you have heavy bleeding, and that was never anything that I suffered with.
You weren't getting a fair shot of finding the answer.
Exactly that. But yes, so
ultrasounds, other things. What did they do to find the diagnosis? What was the journey to get you to say, we've done this?
So I had extensive physiotherapy sessions. So I had about maybe 3 different courses of physiotherapy. So I think there were over 6 to 8 weeks.
Sure.
3 or 4 of those. Mm-hmm. And then I also saw an osteopath weekly for like a year. And the physiotherapy said that I had pulled a muscle by my spine, and the osteopath said that I had sprained my sacroiliac joint, and that the bottom of my spine curved into the left of my pelvis, which is why it was tight, which is why it was causing me pain.
Okay.
Which all of this is absolute rubbish.
Phantom.
It was not like, it was, absolute rubbish. And I know this because then I went on, I should fill you in. So I kept going back to the doctors because I just thought, if I'm in pain, it needs to be on my record so that something can be done about it. And the more I go, the quicker I'll be seen. Because at this point it was getting urgent, and I was leaving home. I was going to dance college, and it was going to be impacting my life at dance college.
Very much so.
So the dance college, throughout seeing these doctors, I went so much that they actually said I had medical anxiety. And I was then referred to cognitive behavioural therapy for this medical anxiety that I was supposedly had.
Because it's all in your head, of
And
course.
I was just told that it was in my head, that
Yes.
women go through periods and that it does hurt and all of this. And I was like, this is absolutely crazy. And so then I got to college, and I do have a nice following on TikTok, Instagram.
I noticed.
I put something out on my platform and I just said, I've never had a period like this. I think I was bedbound. I didn't go into college. I had hot water bottles burning my stomach. I was taking like pain medication, like there was no breaks, just after the other, and someone actually said on those comments, I'm forever grateful to this one person, because they said, do you know anything about endometriosis? Because you shouldn't be in this much pain for a period.
Yes.
And I was like, what's that? Anyway, I just brushed over it. I think I Googled it and just went, well, I don't have a heavy period, so that's not me.
Yeah.
And then I went to my college osteopath. So we have an osteopath called Rick. He is absolutely fantastic. I owe my life to this man.
Shout out to Rick. Thank you.
Shout out to Rick. I saw him once and he said, this is very, very bizarre, because usually with my patients, I can't recreate the pain. And what I really, really find with Rick, which was so different to other osteopaths, because in the NHS, the osteopaths are really hard to just get an appointment with. So I actually went privately. And going privately, I found it's actually really cheeky. And I've only noticed like recently, looking back at my time, but they just do exercise. Like he said, my spine was curved at the bottom. It's not. I've had an MRI, and he said that he could just work at it week after week. And week after week meant £45 after £45.
Yes.
And it's so cheeky. He was taking advantage of a 15, 16-year-old girl. And it's not great, really.
And they knew they weren't going to be challenged.
Of course.
Challenged and believed in a way that as an adult might have challenged them.
Yeah.
But even then, we all kind of bow down to the people in white coats because we think they're God Almighty and they know everything. But it varies. It really varies. So I'm glad Rick was on the ball.
Yeah, so Rick...
and seeing different.
So he then said, like, this is not a physical thing. You're structurally, you've got quite a strong structure and there's nothing to be worried about, like, in that sense. My spine was fine, pelvis was fine. And he said, he actually was the first person who ever said to me, does this pain like go along with your menstrual cycle? And he said, come back to me in about a month and log when you have your pain. And I went, oh yeah. And I went back to him and it did.
There you go.
And he said, okay, you need to go to your GP as soon as you can and ask for a gynecology referral, and just say you've seen a private osteopath and that they suspect that you may have endometriosis. So then I was referred to gynae. I think it took about 6 months to actually see someone. And then I had X-ray, MRI, ultrasound, which they're all clear, because you can't actually see endometriosis on any of these scans. So I don't know why they do them. And then I was in so much pain, and my mum actually came down with me to this last one because I just got to the point where I couldn't sit in front of a medical professional without crying, without actually getting across how my daily experience was. And I just said, Mum, like, please, can you come? She travelled down from York to Surrey to come to this appointment with me. And the lady I had at the gynecologist was so lovely. And she said, well, the next step is surgery. And the only way that endometriosis can actually be diagnosed is through laparoscopy. So,
wow. No, I hadn't realised. Yeah,
surgery, where they investigate, and if they can remove the endometriosis in the surgery, they do. So that's what happened. I waited about 6 months for that surgery.
Okay.
Then had the surgery, which at this point I still didn't know if I had endometriosis, and I did, stage 4.
Wow. The diagnosis, first of all, having a label after Rick's, astute awareness.
I cried. I was so happy.
Doesn't it start? I know you're still in pain, it hasn't cured you, but somehow a mental shift, you start to feel, okay,
yeah,
now I know what's going on with my body.
Yes.
And somehow you manage it. And then I said, you've got to go through all the hoops of the x-rays, ultrasounds, MRIs,
Mm-hmm.
and humour everybody, and then the surgery.
Yeah.
I mean, you've a sister, a mum, other family, other girlfriends. As a parent, a mum watching their daughter suffering so much, how did your mum cope? How did the family cope? Worried about you, because it could have been anything.
Yeah, I know.
Before you got that diagnosis,
Yeah.
all thoughts through one's mind. You're a strong girl. You really are strong to get this far.
Yeah, I think in my family we've had a lot of medical incidents, so to say. So my sister had heart surgery when she was 3.
Wow.
She then went on to have spinal surgery a couple of years ago now. So kind of like we've lived in hospitals growing up. It's kind of been like, like if you have to have a surgery, you have to have a surgery. So my mum's signed away my sister's life if it was to go wrong, the surgery. So it's all like she's so mentally resilient with stuff like that she was just so supportive. And like if I was to have a blood test, I was so scared, terrified, because my sister had been in and out of hospital, or like when she was little, like it was nothing to my mum. She was like, just go have your blood test. Stop being silly.
Well, a shout out to mum too.
Shout out to mum.
Shout out to mum and the girls in the family.
Yes.
I think little sister might have to come on for a recording herself.
She will.
She has a story to tell.
She has a few stories to tell.
So to circle back to you, because it's all about you. So thank you for that. That's very emotive and very scary little story, to be honest, because you're talking about from a young age, not really being heard, not really being seen, excuses made for what was wrong with you, talking, telling, and eventually it took one person to literally flick that switch and go, do this, get to the gynecologist, surgery. So how are you now? Is it all gone? Is there twinges, or how are you doing now?
I would say my body has adapted to pain. If you were to give this pain to somebody else, their pain tolerance wouldn't be able to cope with it.
No,
and
they'd be flat on their backs.
I just get on with day-to-day life now. I don't want to be a broken record complaining about my pelvic pain. But there's just some moments where I just cannot cope. And the thing with endometriosis is that it grows back. So even though I did have it removed a year and a half ago, it will be growing back as we speak. And I do have the Mirena coil in, which releases progesterone, which slows down the rate of the endometriosis growth.
You did say in the very beginning of the conversation it's lifelong, and then you spoke about surgery, and I automatically, like everybody else, said, oh, she's fixed now, how's life?
Yeah,
but you're not.
No,
you're still living with it.
Yeah, I am. And it really is a pain in quite literally the backside. I'll just be doing daily activity and I'll just get a massive, cramping sensation. And I have never given birth. But the only way I can describe it is having contractions. They come on in intervals. I have to take deep breaths. I have to lie down, no matter what the social scenario is. Like sometimes I'm just in the middle of London having a nice walk around. I can't do that.
Well, I was just going to say, you could be on the tube, you could be traveling, driving, or in the middle of some training.
Yeah.
So you kind of keep coming out all the time, because you will have to explain to people in your close work circle or colleagues why you behave the way you are, because right now and at any moment I need to step off for 5 minutes and recover.
Yeah.
So that's exhausting. I know you're used to it, but it's still exhausting because you've got to keep telling and explaining.
Yeah, and I'm very lucky in the
fact... You
must
be tired.
Yeah, I am. And I'm very lucky in the fact that I do have a very supportive, close circle, and the people that I work with, luckily, are the people I work at the college I went to, so they followed my journey with me, so they understand, they know. I teach kids, if it does happen in a class, I just sit down and carry on. Like, they don't need to know.
True.
It's just,
True.
Life goes on, and you just have to neck a few codeine and you're all right.
Well, that's good to know. But I just want to highlight the fact that you're awesome.
Oh, thank you.
You're a strong, resilient young woman. You've come through a horrendous journey, and you know in your head, I'm stuck with this and I've got to make do. And just when you said, the kids don't have to know.
Yeah.
That's very sweet. That's just taking care of their innocence. And you just need to sit down for a minute and whatever. But you're adapting all the time. And like I said, that's tiring.
Yeah.
Very tiring.
Yeah.
Any advice to anybody else that's listening and might be going, oh, that sounds like me? What little tips would you offer maybe to get an earlier diagnosis and not as long a journey as you? What would you advise?
Definitely. So a lot of people do reach out to me because I'm very open on my pages, TikTok and Instagram, about my condition and about my journey. All the appointments I go to, I do document.
Good.
So I do have a lot of people reaching out to me saying, what are the early signs of it? And you can Google these. But personally, for me, I actually had a bit of a cocktail of a lot of symptoms, which included lightheadedness, really huge loss of appetite, bad cramping, obviously,
right.
the pelvic pain, low mood. It really does affect your hormones, bad skin. And I should have put it all together earlier, really, and the doctors should have too, but I was on medication for my skin, I was on medication for my mood, and I was having really, really bad back and pelvic pain.
Okay.
And when you say that now, I'm just like, endometriosis. And
it's just that.
And it's funny because coming through college, someone has actually been diagnosed, like been pointed towards diagnosis of endometriosis by the staff because they've had someone like me go through the same thing and they've seen the early symptoms. So it's really good in organisations like that for them to also know of situations like mine, because then they can point younger students in the same direction, which I think is fantastic, and they get the attention sooner. But for people who are really young and like me, just coming on their period and having that pain, there's a certain amount of pain and you know it, but in your own body, there's that threshold that you know isn't normal. And that's what my thing, like, it was like a big alarm bell really saying like, this isn't normal, which is why I kept going to the doctors. And you must keep pushing, because no matter how many doctors turn you away, you are the only person who can feel what is going on in your own body.
Yeah.
And if you know that there's a certain amount of pain, like going past that threshold, you just know that something in your body's not right. My MRIs and ultrasounds did not show anything, and then I had surgery and I had the highest stage of particles of endometriosis in my body. Like, it's so hard, but I can't believe I had the resilience to keep pushing through, because I could still be here in like a mental mess, just not knowing.
You could have been. And that's why I'm saying being so awesome and being resilient, because you had a dream, and your other dream is your passion for theatre and dance and the arts. And that's probably the carrot that kept you going, because you were not going to do that. So maybe other things in life, without you realising, kept you going.
Yeah.
You see, all the things you just said, the mood, the cramps, the pains, the skin, people will still put that down to puberty and hormones. So thank you for the clarification of, when you know this is just not normal, you know your own body. It is more than normal. The pain's beyond, and this is different.
Yeah.
Different to my sisters or my friends that are talking about their periods.
Exactly.
So for people listening, push, keep asking.
That's the thing. And I was facing, really low moods, and to the point where my mum said to me, like we need to do something about it, because it's not normal. But now I know that it was because I was putting up with such an intense pain. And when I say intense, like I've had appendicitis to the degree where it was about to rupture. It's way worse than that.
Way more than that.
Yeah.
Wow. Well, we could talk for hours. We might have a round two.
We must,
because I'm sure there'll be people texting and sending me messages, and we'll have a follow up. But I want to thank you for the start of the conversation.
Yes.
And sharing and enlightening us with what we need to be aware of, and educating us, because we all just assume it's just that, and we don't really know what it is. It's an enormous, painful, lifelong condition. And I'm just sending you soft hugs down the airs.
Thank you so much.
Appreciate it. Thank you very much, Mathilde. And we will talk again soon. And folks, check out TikTok. Honestly. What's your sister's first name?
Margot.
Check out Mathilde and Margot. Honestly, it is just entertaining. And they're very talented young women. I love it. Have a lovely evening and enjoy your weekend when you get there. Make the most of life. Keep doing what you're doing. And thank you for sharing your time with us.
Thank you so much. Thank you for having me on. It's been an absolute pleasure and I can't wait for round 2.
Thank you. Bye for now.
Bye.